We've created this short film so you'll know what will happen before you have surgery at one of the hospitals within University Hospital Bristol's NHS Trust. We'll also give you information on how best to prepare for your surgery and things you can do after surgery to help you recover and get home more quickly. You may have already been seen in the preoperative assessment clinic, but just in case you haven't, this is what will happen. Initially, you'll be reviewed by a member of the specialist nursing team. They'll ask you lots of questions about your general health, your medications and your setup at home. It'd be really helpful if you could bring a list of all your medications to this appointment. They'll also do routine observations such as your heart rate, blood pressure, and they may do other investigations such as a trace of your heart called an ECG. They may also take some blood samples and do an MRSA swab of your groin and your nose. During your preoperative assessment appointment, you may also see an anaesthetic doctor, or on occasion you may be asked to come back to see us another day. They'll ask you more questions about your health and fitness levels and details about any anaesthetics that you've had before. Sometimes the anaesthetist will ask you to return for more specialist investigations to help us assess how your body will respond to surgery. For example, you might need to have a scan of your heart called an echocardiogram, or it may be helpful for us to have lung function tests to assess how well your lungs work. Sometimes you'll be asked to do a cardiopulmonary exercise test, where you'll be asked to walk on a treadmill so we can see how your heart and lungs respond to exercise. The results of all these investigations will be reviewed by a member of the anaesthetic team prior to your surgery. In the preoperative assessment clinic, the anaesthetic doctor will explain about the anaesthetic process and the type of pain relief you'll receive after your specific surgery. Having surgery is quite stressful for your body, so the anaesthetic doctor will give you advice to help ensure you're as fit as possible for your surgery. The fitter you are, the quicker you'll recover. Evidence suggests that patients who maintain routine physical exercise before surgery have a smaller chance of complications and are more likely to have a shorter stay in hospital. Because of this evidence, we ask all of our patients to try and maintain or even increase their activity levels before their operations. For patients who have a reasonable level of fitness, we recommend they try and double their daily activity levels. For example, if you already walk 15 minutes every day, why not try and double that? The Chief Medical Officer advised that everyone should do 2.5 hours of moderate exercise every week. And whilst we know this won't be achievable for everybody, there are some simple exercises which require no equipment that you can do at home. For example, perhaps when you're sat watching TV, every time the adverts come on, you can do a sit-stand test. This is where you stand up and sit back down again as many times as possible in 30 seconds. Or if you have stairs at home, perhaps you could set yourself the challenge of climbing them a set number of times per day. Make sure you don't overexert yourself. When increasing the amount of exercise you're doing, always ensure you can still talk whilst doing it. If you find you get out of breath, slow down a little or stop to catch your breath before starting again at a slower rate. Lung exercises performed before and after your operation can help to reduce the risk of lung problems by opening up your airways and helping to move phlegm. Evidence shows that doing lung exercises, coughing and walking after surgery can prevent chest infections after your operation, and this can help reduce the length of stay in hospital. Practicing respiratory exercise before your operation will make it easier to perform them afterwards. Here's our 6-step guide to breathing exercises. Sit upright in a supported chair, breathe in and out normally. Take a slow deep breath in so that your ribs expand sideways and your lungs fill up with air, and then exhale. Next, take a slow deep breath in and expand your lungs. Hold that breath for 3 seconds and then slowly exhale. Repeat this exercise 3 times. If you start to feel dizzy or tired, return to breathing in and out normally. Try and practice these respiratory exercises every 2 hours daily before your operation. The anaesthetic doctor will also give you lifestyle advice to help prepare you for your surgery. For example, if you drink alcohol, the anaesthetist will suggest that you try to reduce the amount of alcohol you consume. This is because alcohol can reduce the function of your heart and it can cause dehydration. However, if you drink a lot of alcohol, reducing this suddenly when you come into hospital can also cause serious health problems. So it's much better if you cut down well in advance of your operation. The anaesthetic doctor will also give advice on stopping smoking. In addition to the general health risks associated with smoking, research has shown that smoking increases the risk of heart and lung complications after your surgery. It increases the time it takes for your wound to heal and will increase your length of stay in hospital after surgery. The anaesthetic doctor can refer you to a specialist smoking cessation nurse to help you stop smoking before your surgery. Depending on the type of surgery you're having, you and your friends or family may be invited to attend a preparation for surgery class to further discuss things you can do to help improve your fitness for surgery and help reduce the risk of complications. The pre-operative assessment clinic process can take several hours because it's important we get all the information we need, can do all the necessary investigations, and that you get to see everyone you need to. We try really hard to keep it to a minimum, but please be aware you may be with us for a while. We hope you found this film helpful. Please go on to watch one of the specific films about what exactly will happen when you come into hospital for your surgery.